Dr. Reagan Anderson, who is a dermatologist in Colorado Springs, Colorado, who practices dermatology, practices cosmetic dermatology, practices oncologic dermatology, which is the care of skin cancer. And he also has another career, I think. He's written a book, and he's also talked and written about why healthcare is for the rich. So, Dr. Anderson, welcome to the show. Thanks for being here.
Thank you so much, sir. Thank you.
Okay, so why don't you tell us a little bit about your practice?
Sure. So I am a Mohs surgeon named after Frederick Mohs. And what I do is I remove big skin cancers off of people's faces and bodies, and then I do the reconstruction work necessary to get them back to a acceptable functional and cosmetic status. And that's a little over half of my practice. The rest of my practice is spent doing simple excisions for skin cancers and bad moles, those sorts of things. About 2 or 3% of my personal practice is seeing patients for rashes and acne and that sort of thing. And way less than 1% of my practice is any cosmetic work. I am fortunate to work with a number of physician extenders and doctors, and I'm just grateful to do what I do. I didn't always do this, though. I was in the military prior, and I did 2 tours in Iraq as the 1st Reconnaissance Battalion surgeon. And so I spent parts of 2004, 5, and 6 in Fallujah taking care of anybody who needed medical attention.
Well, that's quite an interesting career. I use that term in a very favorable light. So you also write and talk about health care, and one of the issues that you raised when we spoke is about healthcare insurance is mostly for the rich. I'm curious, what motivated you to get into that?
Well, probably, I think all physicians after a couple of months in practice after our training were very quick to realize that the system is skewed, and it's skewed on a couple of different fronts, and all of those fronts are designed to not prevent disease. So you're a urologist. I'm not sure if you're still practicing, but I know that's what you used to do. How much of your medical school and residency did you learn on how to prevent urologic disease?
I think quite a bit. And,
really?
I think I did. But incidentally, I'm not practicing now. I'm retired.
Okay. Interesting. Because you're probably the first physician I've ever spoke to who has said that. I know in my medical school, we spent less than a week learning nutrition and exercise, as well as how to keep ourselves mentally fit, so mind, body, spirit. We didn't talk about, eating cruciferous vegetables, and we didn't talk about all the things that you can do to prevent disease in the first place. We spoke about how to give a drug, how to do a surgery, how to do these things, how to diagnose disease. But I personally, I'm a osteopathic physician. We're supposed to be a little bit more holistically oriented than our allopathic brethren. I'm not sure that really plays out anymore these days, but that's kind of our background and our roots. And even with going to the founding school of osteopathic medicine, the amount of time I spent on prevention was next to nothing.
Yeah, I would agree with you. The reason I got involved with nutrition is I was fortunate. One of the ladies in my medical school class was a dietitian. And so we're going like, ha, what's a dietitian doing going to medical school? And she said, well, I think a lot of the diseases that we have are caused by the foods we eat. And that was a little futuristic comment that kind of stuck with me, so I paid attention. And I also go to the gym a lot, and I talk a lot to the trainers, and so I've learned a lot about nutrition and mind-body attachments and those kinds of things.
Absolutely. But most of that was done outside of your traditional formal education, correct?
Yes. Yeah, absolutely.
Yes.
The formal education was lacking back then.
Right.
So how did you get involved in other than dermatology. Put it that way.
Well, I just, most of it was off of my own individual curiosity of what could we do to prevent disease. Disease is enormously profitable, and prevention is not taught in traditional schools. I mean, we have to find it on our own. So most of my quest was try to figure out how I could be the healthiest version of me possible and help any patients who are willing to listen to that. You know, Hippocrates said, "Let thy food be thy medicine, and medicine be thy food." Obviously not in English, but I think it's very important for us to start focusing on prevention because disease is so expensive. So between 50 and 85% of all healthcare dollars that are spent in America are spent treating enormously preventable diseases if people would pay attention to their diet, exercise, and mental well-being. And so when I started learning all these things, I started seeing my patients going bankrupt, not necessarily from my treatments, but from mostly hospital stays and those sorts of things. I really started to develop a keen interest in what is wrong with our healthcare system. You know, we have all these different fixes, I'm doing air quotes here, fixes for our healthcare system. And one of those quote unquote fixes is Medicaid. But I think you and I would have thousands and thousands of stories of the Medicaid population being underserved. It's not really insurance. It is a way of keeping people as second-class citizens. It's a way of saying that we're giving insurance without really providing much adequate care, especially in prevention. You know, there's about 75 million people in America right now on Medicaid. And if they need a specialist, if they need you, or they need a dermatologist or a cardiologist or a GI doctor, they need any of those things, it's good luck, because we get paid so little, if we ever get paid for doing those services, that we have to ration care to that patient population. Let me give you an example. I'll do a cancer surgery. I'll remove a cancer on someone's back. And Medicare, so insurance for the elderly predominantly, that you get after you're 65 years of age, usually, they will pay me about $400 for that surgery. And that about covers the cost of the surgery. There's maybe $5, $10 of profit in there after you cover all expenses. Medicaid will pay $100 for that exact same surgery, and they won't pay it immediately. They'll pay it after 3 or 4 months in multiple documents and multiple charts and back and forth, which probably costs $30 to $40 of my staff time with all the hassle they give. So Medicare pays about $400. That's about break even. Medicaid, after all expenses, pays somewhere between $60 and $80. And so what the majority of specialists do is they say, look, we have a heart. We've got to help this population. So we will take Medicaid, but we have to limit how many people we'll actually see. Otherwise, we'll go bankrupt. I mean, you can't take a $300 loss on a surgery and do too many of those and still be able to keep the lights on. And so that's just one example of how medical care in this country is for the rich. If you're poor and you have Medicaid, you're treated as a second-class citizen. And, you know, Jeff, imagine if you were 5 years going into a doctor, and one of the first examples of your class of citizenship is that, oh, you need a procedure, but you're going to have to wait 6 months, whereas anybody with private insurance would be able to get that service within a week or two. And it teaches people from the very beginning that they don't have a seat at the table, and that is, in my opinion, unconscionable, and one of the many, many, many examples of how the inequities of our healthcare system are playing out day to day in people's lives.
Well, I agree. You know, when I was in practice, we, you know, like you indicated, you know, we both have hearts and we want to take care of these people. There's one particular procedure called a lithotripsy where patients would be put on a table and we would send sound waves with anesthesia, sound waves through the kidney to break up the stone. And that procedure would usually bill out. Medicare would pay us about $800. Medicaid paid us $150. And again, you know, I was willing to see many Medicaid patients in order to serve that group. But if we were not making enough money to cover our costs because we had to pay the company that provided the machine, so like you, we had to limit the Medicaid population. And interesting, too, is other urologic groups around the state found out that I was taking Medicaid patients for this procedure. Then they started referring them to me, and pretty soon it got to be, until I intervened, it got to be that that's all I was seeing, and I wasn't even covering my expenses. So I agree with you. That's one of the big problems with healthcare in this country.
Oh, it's huge. And it extends beyond healthcare. It extends to education, for better zip codes having better access to education. It is so pervasive. And we're in a country right now where we have food manufacturers that will do anything and everything to engineer the food or chemically modify the food. And I'm doing food again in air quotes because most of these overproduced, ultra-produced substances really have little to no nutritional content. But they have entire PhD scientists and chemists out there that are trying to make these substances as biologically and psychologically addictive as possible. They're trying to make them actually have no real nutritional value so that your body is starving for them so that you eat more. And then they're putting the right amount of salt and the right amount of fats and the right, bad fats and all this stuff in there so that you're hitting the dopamine centers of your brain, which is triggering the addiction center of you. And then they're putting other chemicals in there to make you never feel full, so you eat the whole bag of potato chips. I mean, it is absolutely atrocious what we've allowed our food industry to do to us. And unfortunately, people in the lower socioeconomic classes oftentimes fall prey to these types of foods because in a lot of those neighborhoods, they do not have access to carrots and broccoli and good grocery stores where they can buy decent food. It's one more example of how we are not focusing on prevention and how we are allowing a systemic-wide system from top to bottom to hurt those in lower socioeconomic classes.
Yeah, I remember when I was in practice, let's go back, I think I'm talking about 10 years ago, there was an article in the Journal of Urology, of all places, and the article was called The Chemo Prevention of Urologic Disease. And basically, they went through all the vitamins that people could need to prevent different cancers. And the one I remember specifically was vitamin A. Apparently helped modify responses of the bladder lining to some of the carcinogens that are in the foods that we eat or smoke. And I thought that was fascinating. But then they made the point that a lot of the fresh fruits and vegetables and other foods that we use are in the supermarkets, and they lay there because they go from the field to the distribution center to the stores. So by the time they get to the stores, they presented the idea that these foods had not much nutritional value. So they recommended that you take a multivitamin, and my colleagues thought this was hilarious. But I think when you are in the beginning of a change, that the new ideas get laughed at, and I think that's where we are. Not as much, though.
100%. And they did a study about a year and a half ago where they studied ultra-processed foods, which the standard American diet is full of. And they said that if you consumed more than 4 servings of ultra-processed foods a day, you had an increased risk of dying from all causes by 62%.
Wow.
And for every 1 ultra-processed food that you added on top of that, you increased your odds of dying from all causes by 18%. Now, ultra-processed foods, those are your hot dogs, your processed cheese, your corn chips, your carrot cake, your cookies, your soda pops, your sports nutrition drinks, which I'm laughing at the name of. the standard American diet starts off with an ultra-processed food of a cereal in the morning, and then has some sort of fast food later on, and these things are killing us, and again, disproportionately affecting those people who are not as affluent. And there's other really horrible statistics out there, like 58 out of every 1,000 Native American households, they lack adequate plumbing water, and that's compared to 3 out of 1,000 white households. And this disparity should be a public health crisis. Unfortunately, those populations are often not thought of and not considered. And so if you really start diving in, if you look at COVID deaths, people of color in our country have disproportionately been affected by severe cases of COVID. Now, some of that is due to vitamin D status, because we know that our immune system shifts when you are deficient in vitamin D. And we know that the more color your skin has to it, the less vitamin D you get from the sun. So people of color tend to have less vitamin D, and they tend to have a worse reaction to COVID. Now, as a dermatologist, please, everybody, do not buy the myth that you get enough vitamin D from the sun, so go out and lay in the sun. That's not true. You get it mostly from your diet and supplementation. But part of the reason for the disparities and who COVID has really hit hard is simply due to lack of access to care for medicine. You know, very disingenuously, a number of years ago, the Republicans decided to call universal health care socialist, because they know that in America, if you say anything socialist, it automatically will repel the majority of us. And when you look at other countries that have universal health care, and I'm trying to reframe it, by the way, as comprehensive health care, because universal health care has a black eye on it now. But if you look at all these other countries that have comprehensive health care, they have measurably better health outcomes than we do. We are 37th, Jeff, 37th in the world for health care. Not because our doctors aren't the best, we are. Not because we don't have the best machines, we do. Not because our training isn't good, we have the best training. We have all of those three the best in the world. But because the rationing of healthcare in this country is so atrocious, we're 37th. Now, a lot of people listening to this, if you happen to be Republican, you're going to shake your head and you're going to say, oh, Reagan, that's not right. Well, look it up, guys. It's 100% right. And if you're on the Democrat side of the House, you're going to say, yes, we have to have this because it's a social responsibility construct. And I would argue with that half of the House as well to say, no, that's not 100% right either. We need a system where it does not matter what zip code you live in, what color your skin is, what fill in the blank. We need a system in America that is not going to discourage us from living to our potential. The only thing that discourages us from living to our potential is our own free will. And if we have universal health care or comprehensive health care, and if we do it properly, so that if people who are abusing their bodies their whole lives and have pre-existing conditions by the time they turn 65, if they're held accountable for their bad health choices and pay into the system early for those bad health choices, we are going to have an abundant supply of resources to have comprehensive health care in this country. If we were to just have one set of rules for, you need a knee replacement. These are the rules by them. And there's a way to, if there's something that's outside the box, to get it even though it's not in the rules. And if we had one set of prices that every physician got paid for that service, we would save over $6 billion a year, which is enough to reduce everybody's copays and deductibles to zero and increase services for the elderly while insuring every American. Now, we don't do that because our insurance companies have convinced everybody that that's not possible. But the system we have right now is not a free market. The system we have right now is you go to the doctor, You hope that you can afford it, even if you have good insurance. You hope that you can afford it, and you really wonder at the end of the day how much this is going to cost. America, as far as I know, is the only developed nation on the planet that even has a category of bankruptcies called medical bankruptcies. And there's over 500,000 of those every year. Over 500,000 from medical bankruptcies. 37th healthcare system on the planet. And yet people still want to shake their heads and say, oh, there's not enough money for this, and oh, this is socialized, and oh, it is such, it is so wrong. It's like saying gravity doesn't exist, and people will refuse to do their own research on it.
Well, I completely agree with you, and I've had, there's a lady who is a healthcare consultant. She's been on the show. She's written for the Wall Street Journal and was a healthcare consultant for Rudy Giuliani, the former mayor of New York. And she and I have had this discussion about universal health care. Now, she came from Canada, and now she's a U.S. citizen, and she made the point that there were long waiting lines in Canada, and if you had universal health care here, it would be, again, long lines. But the way things have developed now, particularly with COVID, it seems like we do have longer lines, and it's more difficult with the insurance companies to negotiate all the different choices and forms to get the care that we need. So I like your term, comprehensive health care. I think that takes away some of the evil tones of saying, that we need universal health care. You're right, that's socialist term. Anyway, so we have a few minutes. I wonder if we could switch gears and you could talk about your book, Universal Death Care.
Sure. Oh, and again, thank you for having me on the show. So I wrote the book, Universal Death Care, A Solution for Healthcare in the Age of Entitlement. And, I was a doctor to Marine Recon. And for the people who are listening to this who don't understand what Marine Recon is, it was the branch of the Marine Corps that had all the specialized assignments. So very, very loosely, very extraordinarily loosely, we were the Navy SEAL equivalent in the Marine Corps. And we had the hardest assignments and the toughest jobs with the least amount of resources. And I did 2 tours in Fallujah, Iraq with these gentlemen. And I spend over half the book talking about the stories of Iraq and then tying those stories into American healthcare. So the stories they're heart-wrenching to read, and they're fairly compelling. And at the very end of each chapter, I try to describe why we are in a war with healthcare in America and draw the parallel. And then I spend the rest of the book outlining things that are wrong with our healthcare and what we can do to fix it. The number one thing, Jeff, in my opinion, that we can do is stop defining ourselves as Republican or Democrat. That is enormously unhelpful. George Washington said, close to his deathbed, that what would eventually destroy this country are the political parties. And I don't think it takes a rocket scientist to understand that's what's happening right now, is that people don't care about talking to other people. They don't care about listening to other people. They don't care about doing their own research. The only thing they care is beating the drum of whatever political party they've happened to attach their identity to. And so the entire book, first of all, it's entertaining. Everybody who's read it has been shocked. It will give people, I think, a more accurate depiction of what war is actually like and why we need to be so very careful to go into it. But it will also help people to do their own research and hopefully then talk to each other instead of yell at each other.
Doctor, my apologies. We have to end this interview. We've gone without a break because it was a fascinating outlook, and I concur with you completely on your points. The name of the book again, Doctor?
Universal Death Care, A Solution for Healthcare in the Age of Entitlement.
Dr. Jeff Rebuffo, I thank you. Dr. Reagan Anderson, I thank you, sir, for the time. And once again, thank you all for tuning in to Dr. Jeff Says here on WLIS and WMRG.